How's everybody doing? Good. Okay, I have 15 minutes or 5 minutes to tell you about a success story and how we're going to try and take that globally. And we want to invite you to be with us. So I joined the Irish Health Service in 2018 as the Chief Information Officer. I previously worked with Intel and MasterCard and a few other global companies. I quickly realized actually it was going to be far easier and much more value to work to transform the entire health system rather than transform the IT organization. So I quickly moved on from being CIO to Director of Digital Transformation. I had the privilege of chairing a European Commission high-level group for 7 or 8 years, and myself and a guy, Prof from the Commission, published this book, Open Innovation 2.0. Based on best practice all around the world, it's about how do you transform the industry using digital technology, and we use that. The secret that management consultants don't want you to know is that 90% of strategies fail. But I want to tell you about a strategy that actually worked, because the challenge we had when I joined the HSE, we were 90, 100,000 employees, but Ireland's health system was ranked number 80 in the world. So number 80, so there were lots of companies that were poorer and weren't as established, and we had amazing conditions, but we're number 80. And our chairman, Sir Kieran Devaney, his advice was do one thing and do one thing, do it well. So I took on the challenge. We're going to enact a transformation, and our singular goal is to lift Ireland from number 80 into the top 10. The strategy worked. It was a very non-linear path. It was exponential change, and I can't claim all of the credit for that because many people worked together. But last year, when the CEO World Rankings were announced, Ireland was number 6. So we went from 80 to 6 in 5 years, and that was our 10-year goal. I won't tell anybody in Ireland in that, because if people hear about that, they say, oh, we're done. And we have so much more to do. But we set a vision of a digitally enabled healthcare system. We started a digital academy with colleagues Lorraine Smith and Ross Cullen, and I'm joined today by Aisling Gannon online, who's helping translate the Irish success story into a global success story. So I stayed in the HSE for 5 years, but 2 years ago I moved back to the Maynooth University, the Innovation Value Institute, and we are taking the HSE Digital Academy and proposing to make that an international digital health academy. In 2007, with our current Prime Minister, we established the Innovation Value Institute. It's modeled on the Software Engineering Institute at Carnegie Mellon that drove a structural change in the way companies write software. And our goal at the Innovation Value Institute is to drive a structural change the way governments and organizations get value from IT. A couple of years ago, we were privileged to have Jerome Adams, the 22nd US Surgeon General, as our distinguished speaker. We've published something called the IT CMF, which was built by over 100 organizations, and it's the gold standard for measuring and improving enterprise IT capability. We use a methodology called a guided open collaborative ecosystem. If you're interested in learning about this, I published a paper on this in Health Management earlier this year. And it's a way of delivering exponential and multiplicative outputs from an ecosystem of people who are committed to change. Changing a health system is really difficult, and if you do it in a linear fashion, you're completely going to fail. But we took on an exponential approach. We applied some science, we had some luck, and we had some amazing people work with us, and the transformation worked. I want to tell you about one of the initiatives is a vision for a whole new different kind of health system, which is based on people at the center. We call the paradigm stay left, shift left, 10x. Stay left's about keeping people well, or if you have a chronic disease or need rehab, we can do that best of all from home. And sorry, my slides are getting ahead of me. Shift left is about getting you home as quickly as possible. And 10x is the notion that we can do things 10 times faster, 10 times cheaper, 10 times better. And we've been able to achieve that in multiple living labs. So I want to tell you about our academy. And education is the first thing you need to do on a transformation journey. And the absolute cornerstone of our success was establishing a master's in digital health transformation. I was able to pull our eight research universities into Maynooth University, all the top professors in the country, and we agreed we would work on developing a world-class master's in digital transformation. We've just completed the 5th year of that master's, and we've trained over 220 clinicians. What was really important, though, we didn't ask these clinicians to write a dissertation. We asked them to drive a digital change project. So we've now had about 110 digital change projects across the system, and they've been foundational. And I'll finish in 1 minute. We've had some distinguished lecture series. We run an international summer school. We just completed that last week, and I've just invited Alan Lebrique to be our distinguished speaker. Derek Manine, who was here, he spoke at our UN Digital Health Symposium. And we also run master classes. A very successful one is with Ogun Gurel from the University of Texas, a mini medical doctorate. So I'm going to finish. We are moving this academy from an Irish academy to a global academy. I'd invite you to help us and work with us. There's a QR code here. We're going to launch this academy at our 5th UN Digital Health Symposium in New York on September 21 and 22nd. Maybe some of you will join us. And we've announced an initiative called Mission 10X, initially in Ireland, then globally, to build a 10 times better health system. And we think we can do this with a proactive health mindset, with digital technology and empowering patients. And please, go to the link, fill in our survey, and maybe you'll be part of this academy. Thank you very much. Merci.